Thanks to all of our partners, everyone who's here and all of your teams. So it's my great pleasure with colleagues to open the unit. Oh, it's been lovely to be back down to Mount Gould today to open up officially the Discharge Assessment Unit. It's been open for 11 weeks now, and we've seen over 220 patients come through the unit, and they've then gone on to either home or their next place to reside. It's been a complete transformation, and I can remember these wards when I first worked in Plymouth some 20 odd years ago, and over time they've sort of not been used as much, but the building team and our partner Nevada have done the most incredible job to completely transform these wards in such a short space of time to get them to very contemporary standards for excellent rehabilitation, reablement and care. It's always a team effort to do this. It's never just one person, but we must thank the planning team from Derriford and our incredible partnerships with Livewell Southwest, with the ICB and all of our colleagues right across health and care that have really developed this as a philosophy and a new way of working.
So when I got here, oh my God, it's amazing. It literally is. You've got gorgeous views, everything's so nice, the people are gorgeous here, really lovely people. I wasn't sure whether it would be like physio, sort of like intensive physio all day or something, but I didn't mind, whatever. So, but just to get me home, it was just a step closer to being home, made you feel better.
So our patient feedback has been phenomenal. I've seen the care and attention that the staff have given to individuals, working with them, working with their families, to enable them to make a safe transition from an acute hospital to going back home, building on individual needs. It has been really emotional to see the success that has been delivered.
To produce what we've done in the time that we've had could have only been achieved with a real collaborative approach and working alongside the consultants that we had and the design teams that we had, but also with the staff at Mount Gould and Trust and Livewell and the estates. The only way this project was going to be achieved was by working together and not against each other, and that real can-do attitude.
Transformation over the last few weeks has been absolutely phenomenal. There's been so many people working really hard to get this unit together. The staff are so happy to be working here, and we're now open and running 11 weeks in, and we are full with patients, and it feels really good. Really excited about what we have going into the future.
We're going to have a bit more data soon to show what a positive impact it has had, but actually if you just read the patient feedback, you cannot help but feel completely inspired and a little bit choked, if I'm honest, about how much this has meant to people and really supported them on their care journey. So huge thank you to everyone that's been involved, to our staff, and this has been the most fantastic official opening I've done for a little while.